First of all, thank you everyone for joining. We're going to cover some updates to the Heads Up platform that I think will be very relevant to practitioners who are trying to keep a really close eye on the health of their clients and patients. This is something that I've been getting requests for since I started Heads Up many moons ago. Yeah, we'll be sending out the recording. But from the very first days I started building the system, the requests we were getting were always coming back to the question around, can Heads Up just automatically start to find different signals for me in the data and bubble them up so that I don't have to even really be logging in and checking the system anymore. So it's this concept of being able to automatically surface insights or automatically surface when the values for a particular individual are trending in a direction that could be positive or negative. And that's actually been a really hard challenge. It's taken us a while to get it right. And we're excited to announce it and provide some additional information here on what we call alerts and reminders. So I'm going to go ahead and share my screen and we can formally, officially roll the tape. So alerts and reminders, never miss an important signal in your client's data again. That's really what we want to enable. Heads Up is intended to be the system that can make it efficient and easy to find exactly what you're looking for in the system. And this new functionality that we're going to cover is the key to being able to do that effectively and at scale. So today's agenda, we'll do a quick intro here. Then we're going to dive into alerts and reminders. First, we'll just do an overview on what it is. Some of the attendees on this webinar, if you're already a Heads Up customer, you may already be using the feature. If not, we'll just give you an overview of what it is. We've got a few case studies of how existing customers are using alerts and reminders in practice today. Then I'm going to turn it over to Alex. He's going to show you how to configure a few of these on your own so you can start to test them in your organization. We'll cover a few other product updates that I think are just good to keep an eye on. We've got some updates to some of our big integrations, and then we'll wrap up. And throughout the webinar, I'll be keeping an eye on the chat, so fire away if anyone has questions as we go. Erin is not on the webinar. Erin was flying to New York today for Integrative Health Symposium, and her luggage got lost. So that's always fun. In said luggage was her laptop. So Erin will not be joining us today. It'll be Alex and I. By the way, if anyone's in New York for Integrative Health Symposium, stop by the Heads Up booth. Our team is there. So they'd love to hear from you. Alex, quick intro for the team here. This is really the first webinar you've been on with us. So you're usually the wizard behind the scenes, building and helping us make all these awesome features, but it'd be great if you could take a minute and introduce yourself here.
Hi, everyone. My name is Alex Smith. I work on the product team here at Heads Up, and I've been with Heads Up for a while now. I worked with Dave around the start of the pandemic, which has been quite a long time. So I work on our backend and web products, manage those, and also do some customer support and project management type work with some of our larger enterprise customers. So I'm excited to be here and show off some of the cool stuff we've been building behind the scenes.
And Alex is also the guy who will create a lot of the custom alerts that we get from customers. So if you're coming to us with any type of specific requests, Alex is also the guy I'll interface with who can bring these to life for you. So thanks, Alex. Great to have you on. So let's just look at the problem statement here. There's more and more sensors capturing more and more data from individuals, your clients, your patients. Take an Apple Watch, for example. It's measuring heart rate every 5 minutes. It's measuring resting heart rate. It's measuring VO2 max. It's measuring calorie burn. We take a continuous glucose monitor. It's sampling blood glucose every 5 minutes. We look at an Oura ring. It's measuring, I don't know, a dozen metrics every single day in real time. So you take all this data and then you multiply it by 10, 100, 1,000, 10,000 individuals that you're monitoring. And it becomes impossible to really find the specific signals in the data that you're looking for. And that's been a challenge, is how do I determine, for example, if someone's blood glucose levels are trending in the wrong direction for 3 days in a row? Or how do I determine that someone's resting heart rate has actually gone down by 15% in the last month since they started a new protocol, which is an extremely positive indicator inside the data? So the challenge is for you as practitioners, how do you find the exact signals in the data that you're looking for in a concise and easy way? And that's really what alerts and reminders was intended to do. As we have more data, more individuals we're looking at, more metrics, they're getting sampled more frequently, it becomes harder and harder to find a signal through the noise. So the solution we've built to this is called alerts and reminders. So if you're a practitioner and you're logged into your Heads Up account, you're going to see this here in the left navigation menu, alerts and reminders. And we're going to show you how to start setting these up on today's call. And we're going to show you exactly how to configure these so that you never miss an important signal in your client's data again. Example, we'll give a few case studies here of exactly how this is being used in the wild, but the goal here is to make it easy to subscribe to exactly what you want to know inside the data, and you just get a nice ping whenever any of those triggers are reached, and it becomes really easy to reach out in a timely manner. So that's alerts and reminders here. We've also provided a schedule. We'll show you how this works. You can start to look at all of the events that fire in your practice on a day-to-day basis. So there's a couple different views we're going to take you through to get all of this set up. But before we do that, I want to talk a little bit about the types of alerts that can be helpful for you as practitioners. This will set up the next couple slides, which are specific case studies. But Alex and I have been working with customers now for about the past 2 or 3 months, and we're starting to see this type of categorization of the types of alerts that we're looking for here. So, Alex, maybe you can just take us through some of these, starting with the most basic ones, like, hey, a value went out of range, to some of the more sophisticated ones where we can do things like custom baselines and deviations from baselines. But if you can just break down these types of requests that you're getting from alerts, then we'll go into a few case studies here.
Yeah, for sure. As Dave mentioned, we've got kind of these different categories that are bullet pointed on this slide, threshold, baseline based, personal records, streaks. But this is really a dynamic framework that we've built out, and we are really trying to make this easy to set up new alerts. So not only are those things that are already in the library, those are available, we're also really encouraging our customers to come up with new ideas, and we're building those out for free in most cases, assuming that they're, achievable with our existing data set. So I'm going to go in and share a few of these examples. Dave, do you want me to share my screen and kind of set up a few of those?
No, we're just going to talk through
Okay.
these first, Alex. We're going to do the demo after I go through the case studies. But just
So let
give a
me,
basic example, like above threshold,
so,
like, for start.
so yeah, so let's start with the simplest. That's the threshold based stuff. And this is a really good place to start if you're new to the concept and new to alerts. So some really simple examples would be, send an alert if one of my patients or clients gets below 6 hours of sleep. And you can configure that. Maybe you want to know if they're not sleeping for one night, or maybe you want to know if it's a longer trend. Send me if somebody's been sleeping an average of less than 6 hours for the past 3 nights. Those are just these threshold based things. Similarly, notify me if perhaps they had a dip in their pulse ox below 90 yesterday. all of these are these absolute values. You can set a line and just say, let me know if something dips below it. Or conversely, let me know if something spikes above it. That can really be for good news as well. We have AM readiness scores coming in from your Aura ring every day, and you might want to send an attaboy to one of your patients if they get a 95 readiness score. You might want to send an attaboy or a warning if the HRB dips or is high the previous night. So all of these are really just set a plain threshold. Those are the simple flavor. Then when we're getting a little more advanced, we're looking at metrics that are a little more personal to the individual. And that's where we start calculating baselines. So for baseline period alerts, those are typically used with more personalized metrics, like your resting heart rate, for example. Everybody might have a different goal and a different baseline there. So we might take the 90-day or 30-day rolling average and let me know if the resting heart rate for that user dips at least 10% below their rolling average or 20% below their rolling average. All of these can go in either direction, but the concept is calculate the rolling average, let me know if the signal goes higher or lower than that by a certain percent.
Yeah, and that's hard to calculate because, like, you got 100 people in the practice? They all have a different 90-day baseline, and you're looking for a very, very slight deviation. Like, hey, if this person goes 10% above a 90-day trailing baseline, that can actually be a very clinically relevant signal. But at scale, this is just absolutely impossible to calculate and track. So that's where the deviations from baseline come in.
Yeah, it's almost like the system's reading that chart for you and looking for those little spikes, but you don't have to open up 100 of them just to find one of those signals. All
Next,
right, so
we
the
have
next,
personal balance.
yeah. So personal best or PRs and streaks, those are really focused on engagement in my mind. It's sending an attaboy if you're doing really well. So new personal best, your best AM readiness score ever. That's a cool achievement. So let them know, give them a little attaboy. You can use those for any metric, though. I'm giving these examples as common ones, but of course they can be set up for any metric by request. And then streaks
Yeah,
are
we've
one.
built personal best for VO2 max. We have a lot of people that are measuring VO2 max on their Apple Watch, on their Garmin watch, on their Aura, or maybe they're doing it manually. Just having the system be smart enough to know that, hey, you just one of your patients just hit a new personal best of all time. Like, just being able to surface that and celebrate that creates these really beautiful opportunities for engagement.
Absolutely.
Back to you,
Um,
Alex. Streaks.
Streaks are also huge for engagement. That's something that I'm personally really responsive to. The step streak is one example. If you have a streak of 15,000 steps per day, if I have one of these streaks going for 10, 15, 20 days, it's really hard to be willing to stop that streak. So if you're getting a ping every morning saying, "Oh, your streak is 15 days, your streak is 16 days," the next morning you're really going to want to get off the couch and hit that step streak. That's great for clients who are trying to get in shape, lose weight, those kinds of goals. We have other sleep related streaks as well. And in addition, we also have goal streaks, and that's a cool one. So in Heads Up on a client's dashboard, they can even set their own personal goals, and you can let them know if they're hitting those goals day in and day out. So streaks are a really cool one.
Yeah, we've had a few team members at Heads Up that had like streaks of Aura AM readiness scores for like 15 days in a row of 85. And clearly these people are not traveling for business. They're not on the road. They don't have kids, and they're just able to clock out amazing sleep scores every single night. So there's been some pretty impressive streaks just on how well people sleep. But to Alex's point, just finding things that are happening on a consistent basis day to day, another opportunity for really positive engagement.
Yeah. Fetch good news is kind of a broader concept. That's a lot of really good attaboys. One cool example we have is the glucose no spike. So if your glucose is really consistent coming from your CGM, that's really a good news kind of thing you can let your patient know. And then beyond that, again, I just like to reiterate, we can build anything based on the data. So we love to take new ideas, build them out. They can also be more technical as well. You know, we have some alerts that fire when somebody hasn't read the note that you sent them, for example, or if their Aura ring got disconnected. You know, these are a really dynamic system that can do anything on top of the data. So we love to get feedback on new ones.
Hey, Alex, there's a question here from David Harper that I want to address, which is just how do patients get notified, and then how does the practitioner get notified? So, Dr. Harper, the way we've built the system is that when you set up the notification, we've set it up so that you can control who gets notified, because the feedback we got from a lot of our customers was, hey, for some of these notifications, I don't necessarily want my patient to get a ping. I want to get the ping, and then I'll decide when and how to reach out. This is especially true for notifications that could be more sensitive. So in other cases, it's actually really positive, good news, and they want it just to go straight out to the client or patient. In some cases, it's both. So we've made it really easy to get really precise about who gets notified. So you may have certain notifications where only you get an email and a ping, and then you can decide how to reach out, or you can have others that go directly to the patient, or you can have both. So we created a lot of
Yep.
flexibility there, and Alex is going to cover that on the demo.
Yep.
So good question. Thank you. And then Alex, just quickly on reminders and tasks, and then we'll switch gears.
Yeah, so I'll show where those are in the demo as well, but reminders and tasks are kind of a different flavor of feedback from the system. All the alerts are really data driven. Reminders are just more simple, frequent recurrence to remind a user to put in data, whether that's an assessment in Heads Up that you need to fill out once a month for your depression screening, or it's a daily wellness subjective score that you're plugging in. Just how do you feel today on 1 to 5? Um, any of those kinds of things, you can set up a reminder and just say, notify this user to do a thing every day, every week, every month. Reminders are a way to dynamically do that on any of our data points. And then lastly is tasks, and those are pretty cool. Tasks we've built out to automate some process in the system. So the most common use case that we see it used for is you can assign some intake forms using Heads Up assessments as soon as the client is added to the organization. So the goal there is just to reduce the kind of back office workflow overhead and automate things that can be automated. As soon as somebody comes into the system, if they need to fill out some paperwork, we can assign that automatically. We can also send messages on an automated basis using tasks, either recurring or on join as well. So it's all about just automating some of those processes. And we're continuing to build out more tasks as well. So again, we love to hear feedback on what can be automated using these kind of framework systems that we're building out.
So I want to give a couple examples of actual Heads Up customers and how they're using this very specifically today. That kind of gets it out of like me and Alex talking about like bells and whistles and features and buttons, and into like a real world use case. So the first example is Dr. Kevin Sprouse. He's with Podium Sports Medicine, and he's been on one of our past webinars, so you may have seen him before. But Dr. Sprouse works with elite athletes, very specifically with Tour de France cyclists, with Professional Golf Association, and then other forms of elite and recreational athletes. So Dr. Sprouse is keeping an eye on individuals that are at the highest level of human performance. So here are the alerts that Dr. Sprouse has set up in his practice. And he's been awesome with us over the last 6 or 12 months, helping us refine how this feature is built as well. So I want to give a little shout out to Dr. Sprouse just for being great in input on the product. The first one that Dr. Sprouse has set up is to notify him if any of his athletes have a temperature increase of more than 0.7 degrees. Some of his athletes have Garmin, some of his athletes have Aura. There's a few devices that measure this now. but he likes to set this at 0.7. And anytime any of his athletes has a temp deviation above 0.7, he'll check in with them and just give them an early ping and say, hey, there's been a temp increase. Just pay close attention to any potential looming illness. Pay close attention to making sure you get plenty of hydration, rest, and recovery. His clients actually really appreciate the early intervention. In some cases, it's noise. They were pushing too hard, training too hard, went out for a big night. But in other cases, he's actually catching illness early and gets the feedback a day later and it says, you're absolutely right. I'm sick. Thank you. I jumped on it early. So that's the first one he has set. The second ones that he's looking at with his athletes are resting heart rate and heart rate variability. And there he's set up two different kinds of alerts. The first one is he's looking at the most recent day. So if the most recent value for resting heart rate or HRV has gone more than 25% above that person's 6-week baseline, he gets a ping. He also has a second alert saying if this person has gone in a certain direction for 3 days in a row. So let's say that the 3-day average for resting heart rate has gone more than 15% above baseline. So this one's just looking at yesterday. This one's looking at the average of the last 3 days, comparing it to a 6-week baseline and flagging a deviation of 25% and 15%. And this is just what Dr. Sprouse has figured out over years of working with people. This is exactly when he wants to get a ping. And then the last one he's looking at with his athletes is over the last 3 days, has the average sleep been less than 6.5 hours? And again, when he's working with athletes, he needs them well rested and at the absolute peak. So if the 3-day average is less than 6.5, Alex mentioned this example earlier, where we can set these values, look at either just the most recent, so was yesterday less than 6.5, or look at the average over the last 3 days, 4 days, 5 days. Any of these numbers can be configured. So if you want a 4-day average below 6 hours, we can set that up. Or if you want to look at a temp degree above 1.2 degrees. So everything here is configurable, but this is one example of how Dr. Sprouse keeps a close eye on professional athletes to know exactly what's going on so that he can decide how he wants to intervene and keep all of his clients at the absolute top of their game. So, Alex, anything I missed there or that you want to add?
No, I think that's a great summary of what they've got set up, and they're a great user of these alerts. So good study.
All right, this one is you. This is proactive. So they're slightly different. They're monitoring people who have been discharged from the hospital after surgery. So take us through, Alex, how you built these for proactive.
Yeah, so Proactive assigns some remote patient monitoring case managers to these acute post-discharge surgical patients. And they have a big caseload, as a lot of case managers do. So, it's a challenge for them to keep a close eye on a large caseload full of people, which is where alerts came in and really helped them optimize their workflows and pay closer attention to the acute patients who need it at the time when they need that attention. So to that end, they're primarily using deviation from baseline style alerts. And you can see here that they've actually configured them. They've really fine-tuned them. It's not generic, it's specific to each metric. They've fine-tuned the percentage and baseline period. And those are the two primary levers that they have to work with when it comes to these alerts. So for resting heart rate, what they found is let's look at the 30-day baseline and let's identify a 15% deviation from baseline. Now, with resting heart rate, that can be calculated multiple times in a single day. So it's taking yesterday's average and was that 15% higher or lower than the 30-day? And then we're doing the same thing with the other metrics, but using different thresholds and different periods to look back. So for blood pressure, they're looking for a 15% deviation from baseline, either systolic or diastolic over a 90-day baseline period. For respiratory rate, 10% deviation from 7-day baseline. And for weight, they're looking at a 7% deviation from a 7% baseline. And they started out with these kind of configured all the same way, I think 15% 30-day. And over time, they kind of iterated and found that these were the optimal baseline period and deviations to look at. So they have a great setup, and they get a lot of these alerts in every day, and they're able to focus their attention on each one of those. The last one is an example of one of those absolute thresholds that's looking for a pulse ox below 90%. And that's kind of another flavor. Again, these alerts run daily. So in this case, it's not looking for a pulse ox below 90% over the whole day. It's saying, did you have a dip at all? So yeah, those are the ones that Proactive uses, and it's really helped them kind of optimize their practice.
Thanks, Alex. So two very different examples here, obviously. We have Podium looking at elite athletes, and then we have Proactive looking at individuals who have just been discharged from surgery and they're being monitored at home. This one is actually billing insurance for the remote patient monitoring codes, and this helps them determine, is there a potential infection looming from the surgical procedure? That would be part of the resting heart rate. Is there a potential issue that could be related to heart function, which might indicate that there's a significant increase in weight? That could be water weight, for example. So two totally different use cases, but gives you an example of these signals are really hard to find. You've got all these data points, all these baselines, these very, very precise percentages. There's really been no way in Heads Up just to automatically get a ping. You could go in here patient by patient and look at each individual and try to calculate it, also completely unsustainable. So that's where these alerts can be really, really customized and really, really precise. So we're going to do a live demo, but before we do that, I just want to cover a couple other important updates for Heads Up customers that I want you to know about. First is that we've added support for some of the new metrics just released by Aura. So these are all hot off the press. The Aura Ring can now track VO2 max, stress level, cardiovascular age, and resilience. So these will now pull through onto your client's Aura dashboard, and they'll be available to you as metrics. We also upgraded to a new version of the Aura API, basically using webhooks. What that means is that it's just going to sync faster. So there'll be a much faster response from when your client syncs the ring to when the data shows up in Heads Up. And we've got all of the latest metrics from Aura now supported in Heads Up. A big part of what we do is make sure that we stay right at the cutting edge with all of these top integrations so that you guys get access to this data immediately. So you can now find these in Heads Up. We also added support for Polar. We had a few clinics asking us for Polar support. So this device will now pull through. It's got the full slate of metrics that you'd need to do really, really good lifestyle monitoring. Of course, all of these sit into the alerts framework. So everything we're talking about here can be automatically detected. Also, a bunch of new metrics from Withings that we're pulling in. So some of the new metrics they've released here around sleep quality, respiratory rate, some of the new metrics from their scale pull through. And then also a few new metrics from Garmin that are pulling through. Blood pressure, skin temp, I mentioned that. Dr. Sprouse has got athletes with Garmin, so they can now do the temp deviation just like Aura. We've also added weight, BMI, body fat, muscle mass, bone mass, body water percent from Garmin. And then lastly, on the Heads Up mobile app, we've added Face ID. So it's kind of annoying if you got logged out and you couldn't remember your password. So we now have Face ID on the mobile app. So just a few new updates to share. And with that, I'm going to actually turn it over to Alex, and we're going to do a live demo on how to set up some of these alerts. The goal here is that you can go test them out in your own account. We'll show you how to set them up so that only you get notified, which means you're not going to blow up your patients if you misconfigure something or turn something on that's too noisy. So we'll show you how to set them up for internal testing only. If you want to work with our customer success team, just reach out to support@headsuphealth.com and we'll jump on a Zoom call and show you exactly how to set these up properly. But Alex is going to walk through a few examples on how you can start hacking on this today. So over to you, Alex, to share screen.
Yeah, so I'm logged in here as a practitioner to our demo org. And I'm gonna just jump, this is just kind of my client base, and I'm gonna jump over to the alerts activity here. And the first thing that you see is that calendar view that Dave showed. This is just everything that I've set up already. There's a lot going on here, a lot of alerts happening every day, and these are firing at a specific time that I set up. So every day they run, and at 11 a.m. in the user's time zone, they may or may not get an alert, depending on if they meet the threshold. But I'm going to start by setting up a few example alerts that we don't have configured yet in this organization. So when I go to the alerts tab, you can see I've got 4 scheduled here, but I'm going to put in a few new ones by going over to the library tab and selecting from our library. So this is where you can browse all the different stuff that Heads Up has configured out of the box. And you can kind of read through what's all available. There's obviously a lot here, and most all of these fall into the different categories that we went over. In this case, I want to set up just a AM readiness over threshold alert. That's looking for that absolute score. In this case, maybe I want to do an 85. So I'm going to schedule that alert. And when I click scheduling, it brings me to the scheduling interface. This is kind of an administration interface where you have to set it up once, but you can set it and forget it, and then it's running every day. The goal here, though, is to show you all the cool and dynamic thresholds and parameters that we've configured so that you can really fine tune this to your practice. So I'm going to have this start today, and I'm going to have it run at, say, 10 a.m. every day. I want to make sure and run it late enough that people have already woken up and, taken off their Aura rings and Aura data's in the system. So 10 a.m. is a good time to make sure everybody's already awake. I'm going to run this daily when I set up the recurrence. So I'm going to have it just look at yesterday's data. So I'll leave that as the default look back days. And then I can set my threshold to whatever I want. I could set it to 90 if I want.
Can you zoom in, Alex, a little bit?
Yeah, sorry,
just a bit. It's a little hard to see.
No, yeah. Thank you for the reminder. There we go.
There we go. That's better.
Thanks, Dave. Yeah, so I'm gonna just leave it at 85. That's the default suggestion, but you can always up it to whatever threshold you want. And then each of these parameters will have a little description explaining what it does. So in this case, it's just the threshold, but for some of those more complex alerts, we'll see some parameters that really explain how like the baseline period works, stuff like that. What you can also do is customize the notification message. 2 notifications can go out, and you can configure which ones go if you want them to. There's both an in-app notification and an email message notification. The email message is PHI safe, so you can't actually put the value in there, but the notification in the application shows the actual value. So this is just a simple default message, but you can customize this message to whatever you want to send your client. Same with this one, you can customize the email to whatever you want. So I'll leave these default, but of course you can configure them with your own copy if you want. In this case, I'm going to run it daily, but when you're setting up an alert, you can always set a schedule and do it weekly, monthly, annually, etc. So you can run these however frequently or infrequently you want. And then here's where that notification stuff comes in. I think this was one of the questions in the chat. Do the clients get an email? How do the practitioners see the notification, etc.? And this is really up to you when you're setting it up. So what we've often seen organizations do is like, let's dry run these and only the practitioners can see it. And then once we're ready to go, we can show it to the clients. You can control, you can control all of that down here. In this case, I'm going to not notify the client. And I only want to notify a few team members. We have a lot of practitioners in my organization. I don't need everybody to see this. So, I can type in, I just want myself to be notified. From there, I'll click schedule. It's going to warn me because I already have one of these scheduled because this is our demo org, but that's okay. And now you can see it on my schedule and it will tell you the last time it ran as well.
So simple alert. A simple way to just get notified when any of your clients or patients have a great night's sleep. Just an easy way for a coach to re-engage. Just a simple example of like an aura threshold where you might want to fetch good news in the system.
So I'm going to do a couple more examples. Let's do one that's a little more complex, one of the baseline ones. So I want to do one of my nocturnal HRVs. I'm going to just search for it because there's so many in here. I want to do the nocturnal HRV below baseline alert. And when I hit schedule that one, you'll see a little more complex, some more parameters are available here. Again, I'm going to have this run at 9 a.m. or actually the other one I had at 10 a.m. I'll do it at 10 a.m. also. One thing to note when you set up the time, that is going to be based on your user's time zone, not yours. So if you work with users across the US or across the world, the timing is based on their own time zone. So I'll set up the parameters at this point. I want to do a 15% deviation from baseline, not a 10%. And I want to keep the 90-day baseline look back period. And then I want to do 3 days of reporting. That reporting period is the period that I'm looking back to say that this is below. So if the 3-day average is below the 90 days before that, then this will fire an alert. So overall, the alert is looking at 93 days worth of data. It's grouping it into a 3-day current period and the 90-day baseline period, and then it's comparing those averages. When we're looking back at multiple days, sometimes you may want to configure the minimum number of readings too. This is maybe more applicable if I want to go look at like a 7-day baseline and I want to make sure they have just more than one reading available, if that makes sense. So in this case, I'll leave this at one.
So
but you
like
can
let's
always
just
increase
take
that as
like
well.
sleep, right? Maybe you're looking at a 3-day baseline, but the person only wore the ring or wore their device 1 day. So you can determine how many days need to have data in that 3-day look back before it fires.
Yeah. And so I'm going to leave the default notification message. In this case, it's a little more advanced. As you can see, I'm showing the percent deviation and then the 2 values in the 3-day period and the 90-day period. But again, this can be customized as needed. And in this case, I'm going to go back up and actually add a tag filter as well, because I didn't show that for the last one. When you're configuring one of these alerts, you can configure it to run for everybody in your organization, or you can do it by tag. And that's really helpful when it ties in with the parameters, because a lot of our organizations work with different types of cohorts. Maybe we have weight loss patients and elite athlete patients. And those 2 user groups might have different goals, different parameters, different values. So I can plug in whatever tag I might use. I'm going to do Coach Rachel tag because she's the one who's working with the athletes that I want to set this up for. Now I am going to notify the clients on this one, and I'm not going to notify the practitioners, just the clients for this one. All of that is configurable at the alert level. Go ahead and hit schedule. And now there it is, ready to go.
Yeah, thanks, Alex. Again, these can get pretty precise. Like he's looking back at a 90-day baseline. He's looking for a 15% deviation from that baseline, comparing that to like a 3-day trailing average and making sure there's 3 days of data in there. Again, this gets super precise depending on just how precise you need to be. But this is the level of sophistication that we can get to. Alex, question from Dr. Cayley. Are these available for lab biomarkers? I know you're working on that, but
yeah, we're working on building some out. We will have our first lab-based alerts in the coming weeks. So yeah, we're building them.
I think there was one more we wanted to do, Alex. Do you remember?
Yep. I was going to configure
the VO2 Max,
one more.
best.
We can go through that real quick, but it's a personal best one, so I just want to show it as an example. I'm going to set that one up as well and schedule it. So by default, this alerts when somebody gets a new personal best. and it only starts going after you have three or more four or more scores. So the point is, we don't necessarily want to send a "you got a personal best" on day one, because it's always a personal best on day one, right? So in that case, I decided to remove the users with only a couple of values. I'm going to have this one run at noon, and I'm going to set a threshold too. You can do this with any of the personal bests. You can set it up to say only alert them if it's good enough, right? I don't want to send a "you got a great personal best" if it's really low. You can also leave that to 0 if you want to just send the personal best. So this one by default will send, "Hey, you got a great new personal best for VO2 max. Your new max value exceeds your prior personal best of whatever it was on this other date." So that's a really cool one to set up. Really good attaboy for the user. I definitely will notify the clients. I'm going to notify myself as the practitioner as well for this one, just so that I can maybe follow up with them, send a message as well after that happens. I'm going to schedule that one. And now I've got all of my alerts configured. I think the next piece of the demo that I'd like to get into is, how do we monitor these? What do these alerts look like to the practitioner and to the client? Before we get into that piece, though, are there any questions we need to answer in the chat? Or Dave, did you have anything you want to jump in on before we do that?
No, I think we're good. We're on top of it.
All right, cool. All right, so how does this look once we have them set up? I've had these alerts going for a few days. So I'm going to show a couple different places where you can monitor the history of the alerts. The first thing I'm going to do is jump into the alert history tab that's on the clients table activity, and it's a new tab called alert history. And this allows you to see all of the alerts that have fired for your clients in whatever time period you want to look at. And this looks across all of the users in the organization. So I've got a lot here. I can scroll down and see all these things that have fired. This is just in the last 24 hours because our organization here has so many users and so many alerts. So I probably want to filter it down. I don't want to see these reminders. We'll talk about those later. I just want to see the data alerts. And maybe I just want to see like HRV, for example. So I can filter that down and see the exact alert, who it went out to. And then from here, I can read the message that the user got if they're configured. And I can even send a message based on this, which is pretty cool. So if I want to let this user know what I might think about that, "You did great. Thank you for accomplishing this." You can send a message directly from this alert history tab. It'll pull in the alert message, and I can add in whatever I might want and send that message off to the user. And that'll happen. That'll automatically create a new thread in the secure messaging activity. So some integration there that allows you to just communicate based on these alerts. And then additionally, from this view, we can configure our notifications at the practitioner level. So you saw earlier when I set up the alert that I configured this particular alert to not send to the practitioners. Maybe this practitioner wants to see the alert. I can go in and click notify me or remove me to control my own notifications as the practitioner in the system. And when I do, you'll see the little notification bell there indicating. Additionally, that's kind of the alert history for the whole organization. Additionally, I can go in and open up any user, and I can go to their alert history tab as well and do the same thing. This is the same view, but it's kind of pre-filtered from the client profile. I can see their alert history directly in their alert history tab. So this is filtered to just this user. The last thing I want to show in terms of the front-end UI is whenever a user, either a practitioner or a client, gets an alert, those alerts will go up in their notification bell as well. Because I am a practitioner in this organization, I see these alerts for all different clients. Every client who got an alert that I was notified for, it goes into the history table, and I get this alert bell icon for it. If I'm logged in as a client, I only see my own alerts. They also go for the notification bell. In this case, I've got a lot. I'm going to just mark them all as red and move away from them. That's basically how the alerts look and how you can review them. In addition, we have some cool analytics on top of the alerts using Signals, our embedded BI platform. That's really helpful for organizations that are really trying to tweak and fine tune their alerts. You can look at things like how many times has this alert fired per client in the past 30 days. Like maybe you have a goal of not over alerting your clients. So you have some cool analytics on top of this data as well. And that's kind of the
Thanks,
alerts
Alex.
history. Yeah.
Yeah, the only other thing I'll mention is that if you're a practitioner on the system, you can sign in to the Heads Up mobile app and you'll see the alerts for your clients or patients on the Heads Up mobile app as well. I use that a lot. I've got a couple loved ones that I monitor pretty closely on the system. And that way, as long as I've got my phone with me, even if I'm not in the office, you'll get notification inside the mobile app and you can just keep an eye on any clinically relevant signals that you might want to subscribe to right from the mobile app. So it's just a handier way to keep tabs on things on the go, and then you can decide if any of them require taking any action. But just sign in on the Heads Up mobile app with your same practitioner username and password. You'll see the bell icon and you'll see the alerts flowing in there as well. So just different ways to keep tabs on people and making sure that you're able to reach out when the right signals come through. So Alex, thanks. Go ahead and stop sharing here. We'll take any other questions. Again, I would say that you can log in and start testing these out yourself. If you want us to help you out and get a few easy ones set up, what we do for a lot of organizations is we'll just set up 2 to 3 really, really basic alerts. We'll set them to test mode only. So only a select number of individuals in the practice are getting them. Once you start seeing how they roll in, you can decide how you want to customize them. You can decide which ones you might want your clients or patients to see. You can decide which ones are going to be internal only. If you have very specific signals that you need us to look for in the data and we don't have an alert already set up for it, we can build it for you. Again, we want you to think about just the top 4 to 5 really, really important signals in the data that you need to get notified on. We want to help you bring those to life and make sure that you're never missing those important opportunities to engage and identify positive trends in the data. Those are actually oftentimes the most powerful. And on the flip side, also making sure you don't miss any of the clinically relevant signals, which could give you an opportunity to intervene early. So that's all we've got today. Thank you, everyone who joined. If there's any other questions, fire away. Otherwise, we'll have the slides and the recording, and just reach out to us if you want to get started testing these in your account. All right, everyone. Thanks for joining, and we'll sign off, and we'll catch you on next month's webinar. Have a great day.
So Heads Up is a data platform that connects an individual patient and a practitioner provider, and it creates a common space where healthcare can be accurately tracked, measured, and optimized. So how do we do that? Let's take a walk through the system. So the first step is getting users in the system through the Manage Users function. You can import CSV files, and if you have an existing practice management or electronic health record system, we can actually integrate into your existing systems and create what's called a single sign-on connection. And the first thing we do for each client is we give them the concept of their own personal health dashboard. And the dashboard is going to contain the metrics that you need them to pay attention to as part of the journey. So the first thing we do is we allow the ability to capture data from clients remotely. And the way we do this is we connect to the latest cutting-edge sensors and wearables on the market. And what these are doing is they're passively collecting data in real time, sending it into the system so that we can use that for day-to-day, what I like to call micro calibrations. These are the lifestyle changes we can make. So you can see here, we integrate all of the top FDA-approved medical devices, and we will customize these dashboards based on your exact programs and protocols. So the next section we want to review is lab results, and Heads Up is able to take in diagnostic lab data from any source. You can see that we pull in traditional blood work here. We can also pull in data from DEXA scans, in-body scans, urine and microbiome, heavy metals, stool, and we can start to see and track these lab results over time. The next thing we want to look at is what we call progress reports. And progress reports, that's what's going to let us look at an individual's health over the last month, over the last quarter. You can see here, it looks like this day we hit 208. So that's a day I'm going to want to double click into. And I may want to ask the individual, was there a specific meal that you ate on this day? And if I can say to a person, instead of eating a cup of rice, why don't you try a quarter cup of rice? And we start to see how we can make these small changes now that are going to have long-term benefit on preserving the health of the system. You can see we're capturing a lot of different information, and when we work with a clinic or an organization, we'll build each portal to help you capture exactly what you need. So we custom build each instance of Heads Up exactly to your program and exactly to your protocol. So that's what each individual will experience. Now what we want to do is start to say, okay, I've got this data now coming in from dozens, hundreds, thousands of clients. How do I start to analyze this information at scale? First is we want the ability to identify outliers. So the first thing we want to do is have the ability to come in here and set notifications to only flag the things that we're interested in. So that's where we can start to take all this data in and really just look for very specific signals that you care about, that you want to engage in. This is going to save you a lot of time, and it's going to help you identify only the instances where you need to engage. So that's alerts and reminders. When we work with your organization, we'll build out all the intake forms and assessments that you need. They can be quickly assigned, and we'll show you how this data comes in. Each of the answers to these questions is also stored in the database. Templates allow us to create content that we want to create once and share many. This is the HIPAA-compliant messaging, as I mentioned, so we can do secure messaging to each client bidirectionally, all encrypted, all stored in the database, all very secure. Accessible to clients on the go through the mobile app or through the web browser. So here is where we can start to build any kind of report on top of the data that you want of my entire cohort of people. Very simple queries we can do on top of the data to answer questions quickly. So we launched the concierge service, and this is the simplest way for us to help you structure otherwise fragmented data. All you do is click on concierge, browse onto your computer hard drive. Let's say this is blood work for an individual client. All we need to know is who does the PDF file belong to, and you can upload multiple. We will take it from PDF, structure the data, and put it back on the trend line with all of the other tests that represent the same value. That's how we start to holistically bring fragmented data together. We just need to know, what is it that you're trying to measure? How do you want to define success for your program? And then we'll build an instance of Heads Up exactly to your business and get you the exact outcomes you need. That's Heads Up. That's how we make health measurable. Thank you.